What's going on, white to you? So yeah, y'all know I'm kind of getting used to the live thing. I don't know. I started doing the live thing more. So anyway, this is just a chat that I wanted to do, especially since I have my break in work. So we're just pretty much chit chatting and just talking about revenue cycle stuff. All right, y'all. So I'm pretty sure some of y'all are still at work and some of y'all might be getting off. Well, it's like 3 o'clock, so nurses pretty much get off at 3. The office does not get off at 3. The office gets off between 4 and 5, and some of us stay till 7. But since I'm home, I figure I'll jump right in and I'm going to answer some emails that I got, and it's going to be for everybody. So I was working on the book, so there's only a couple of more things we need to do in the book. But I did get a couple of questions about revenue cycle management. No, this actually has nothing to do with your class that we get ready to have on Friday. Nothing to do with that class on Friday. Okay, Friday is medical terminology. If you guys missed it, make sure you get in on that next class, okay? Archive the classes. The medical terminology has a playlist, and medical billing has a playlist. The playlist for medical billing says medical billing and code and virtual. Okay, so we just kind of want to talk about what goes on in revenue cycle. Who is your go-to in revenue cycle? And this is for the billers, and this is for the coders, and this is for those of you who do work at home. Where y'all want me to start? Y'all want me to start from what do we need as far as being hired as a medical biller? Well, me as a director, I definitely want you to make sure that this type of field is for you. Make sure this is for you. Make sure that you're okay with sitting in an office and sitting at a computer and, calling people and, looking at people and, trying to figure out, what the problem is. So, in revenue cycle, the billers are revenue cycle, the coders are revenue cycle, accounts receivable, everybody's revenue cycle. And all of this falls under the accounting department. This falls under the accounting department. Okay, so what was the question? How do I know if, this is something that I really want to do? So that was one of the questions. So this is the answer. You need to figure out if what you've done in the past satisfies what you're going to do in the future. If you've never done medical insurance billing before, you're going to have to figure out if this is for you. Okay. Hi, how are you? What do you suggest for after I get my certification? Are you currently working in the field right now, or are you new to the medical coding industry? So that's what I want to know. If you're new to the coding industry and you have not exercised the coding before, I suggest you start from scratch. I think it's good to start as a charge entry coder. This is for new people, not yet new to the industry. Wonderful. So are you working in the hospital for anything, or in the hospital anywhere? You don't have to say what you do. You work in the hospital. If you're new and you're not used to the hospital facility, the background, and how we work at the hospital, I would start as a charge entry coder. Years ago, we didn't have to have certification for charge entry, but now they're asking for certification for charge entry. Charge entry coder is the medical assistant is taking the paperwork from the provider. She's taking the intake paperwork from the provider. Okay, good. So you also need to, I will take a look also at my book. Where is it? It's online for you guys. That book is free. It's about medical coding and medical billing. Even you, anybody that you know who want to know about that industry and where you're going to land. So if you're starting you're going in for medical coding, in your coding class, are you taking medical billing too? Or are you guys just doing the coding? Are they giving you like medical billing as far as what HMOs, PPOs, and all that kind of stuff? Or is it just strictly coding? If you're going for just strictly coding, like I said, I think you should start with charge entry. But if they're giving you the real rundown of, when you finish this coding class, you need to go ahead and take your certification. How do you feel? Yeah. So when you go on, I mean, your goal is to take the CPC. I mean, that's what this class is about. My class is about everybody taking the CPC. I do have some that do not take the CPC, and they're pretty much billers, and they're just not ready to go up there. So in your coding class, I most definitely would start with charge entry. You could do charge entry right now. You're in school. Charge entry, you already have the codes. The medical assistant, she's going to bring you the codes. All you're doing is putting the codes in Epic. You're putting the codes in Epic. But this still puts you in the revenue cycle square. This still puts you in revenue cycle because our coders are outside. The coders are all over. Here, New York, the coders are all over. But the charge entry person, she's the middle person. But it still gives you that feel of what you're getting ready to do. Because 9 times out of 10, you guys will be doing Zoom. When you put those charges in, it goes to different queues. That queue will go to the coder, whoever has that doctor. And she's the one who's doing the coding, but at least it would give you a feel, to kind of put your feet in there. Because you just coming out of school, they're going to want to make sure that you know what you're doing. And if you're already in a facility, there's your go-to right there. My girls that are already accounts receivable, my girls that are already charge entry, I don't care if you housekeeping, you are in the hospital. So you might see me at lunchtime. I don't care where you work at. If you're in a medical facility or in the medical world at all, ask questions. Because you need somebody to get you in there. There's different directors, there's different supervisors. I hire without. Let's say you're going to school right now. I just need to see, how much you know, how far you know. I know you're in school. If you pass a test with me, I'm going to hire you based on what you physically showed me. There are some, directors and supervisors that don't do that, but many hospitals do that. Have you been working in any type of medical billing, or you're changing careers as a whole? When you change careers as a whole, you want to get your foot in the door somewhere. After you take your certification, changing careers, absolutely. After you take your certification, which would be, I'm definitely suggesting you take your certification. When you take the courses, like the college courses or any type of course, that's the goal. When you go to school for medical coding, it's not the degree that's going to get you the job. It's the certification that's going to get you the job. It is, out of all the accreditations, you must have a certification to be a coder. The CPC lets us know that you have mastery level of coding. That's what that means. I know that when you come in, you are new to coding, but once you finish your course, you have to be ready to take your CPC because you're going to dive into cases. You are the doctor's eyes. You are the surgeon's eyes. Once he's finished with that report, he needs to make sure that you are able to decipher that report and put the correct codes. Because 9 times out of 10, the providers know. They go to boot camps just like we do, cardiology, whichever one they're in, they go to boot camps. But they're not always right with the code. So even if it's an intake sheet and the doctor's writing the code in there, charge entry person gets that. And that gives the charge entry person. So this is, if this is new to you and you're in school, see if you can get a charge entry part-time or something. This gives you hands-on so you can start seeing what those codes look like. Because you're seeing them in school and how they are giving them to you. But you still have to see like real life stuff. When you get in there, you won't be afraid. In revenue cycle management, the coders are par. We are the ones who are responsible for making sure those charges go in, they are not upcoded, and they are not downcoded. When you are going to school for medical coding, ask them everything. Your instructor knows. I'm pretty sure she's not a proctor, but she knows what you're supposed to have to become, truly a coder. When you finish with your class, yes, take your test. At what point, where are you in the class? What subject are you guys up to? You've done your ICD-10. They've already given you, as a beginner, you're coming straight into the school. They're giving you ICD-10. They're telling you where it came from, XYZ, XYZ, and now you're doing CPT. Where are you at in your class, Annie? While we're waiting for Annie to type in. What I would also suggest is some of the chats that I have. That's why I started naming these chats. Even for people who are already in school, I want y'all to look at some of those chats that I have, because even though you're new to this trade, it would get you used to the trade. It would give you more. It would give you more of what you're getting in school. It might be a question that you may have that you just haven't figured out how to ask, or you might not have gotten it out your head. Okay, so we are in medical terminology in our course. So this course that I teach on this, you guys know, or my YTU people, you guys archive. Send me a message if you need anything. The Sapphire Coding Academy, I have two platforms. This one is made only for YTU. Sapphire Academy is totally different. Okay, so the portion, and this is school, because every school has to go by a crosswalk. My crosswalk from school has customer service. Why, Miss Lambert? Accreditation curriculum, and we have to teach it. So Annie, I'm talking on a teacher's perspective and why they are giving you this. Is it necessary in coding? Nah, it's not. I don't give it in my business. I don't give it in my class. Why, Miss Lambert? Because it's not necessary. None of that is on the AAPC. I have the full customer service. I have to teach my students from the customer service book what to approach. XYZ. Why, Miss Lambert? Because the accreditation is expecting me to teach that. You must teach that with your curriculum in a school, a physical school and an accredited school. They have to go by what the accreditation does. Pull that out of yours program because it is not necessary. It is an online program. It does not need accreditation. But if one day I do get that physical school that we're looking for, I have to put that back in there because it is a part of accreditation. Will this help me get my CPC, Miss Lambert? No, it's extra. When you take a course in school, they have to give you what is protocol. Do I think it's good? Of course it is, especially if you're not used to working with people. So the purpose of the customer service, Annie, is to help students to rationalize with talking to other people, seeing what the needs are, seeing how your reaction is, what will your answer be? If you got in a certain situation, will you be calm? And all of those ABC, that book that they give you for customer service, and the test that you give you for customer service, when you get ready to go to job development, that's where that's going to kick in. That's where that customer service and the business is going to kick in. At Sapphire Coding, YTU, I have a business plan for you. We talk about business. We talk about what you need to create your own business. There's really no other reason for me to discuss business. Y'all find that chat, especially if some of you are not going to do your own business. But we do talk about that in relates to some of y'all want to do your own coding business. So I put in there the Bank of America outline and what they're looking for and what you need to have in there when you're developing a business. So I think it's wonderful that they give it, because there's, some people like other people come from different industries, and the post office or stuff like that they are working at the factory or they're working at the plant, and they are used to communicating with each other. But when you go out and you're communicating with somebody else, it's a whole different level. You got to pretty much change your demeanor. So the customer service portion would be my last. It would be my last course. Why, Miss Lambert? Because that customer service, you're almost out the door. My students are almost finished. We medical terminology. This is what we do first: medical insurance billing, medical terminology, ICD-10, CPT, and then you guys are doing your core courses. We're diving in the coding straight up. The customer service was last when I was in the school, because you're almost on your way out the door. You're almost on your way out the door. So we need to get that customer service in. When you take some of these jobs, these Fed jobs, and you got to take a test, it's really a customer service test. What would you do if Mrs. Janko was screaming? What would you do if you was in a situation and you saw your coworker XYZ? How would you handle XYZ? What is your etiquette when you answer the phone? Answer the phone with this etiquette. That's the kind of stuff that they do for customer service. And you guys know, one of my chats I did put in there. If y'all wanted that, I'll put it in here. If y'all want that course, I'll put it in here. And the reason why we made this course is, y'all know I'm anti-student loan. I don't care. I don't even see nobody paying $300 for it. Let me tell you something. When I took billing and coding, I don't know how long it was, 2000 and something, 2003. If I know now what I didn't know, if I didn't know then what I know now, you know what I'm trying to say. I would never have spent $22,000 on a college that I had to pay back. You got to get the right tools. You can teach yourself. If that student loan going to mess you up on your DTI, don't do it. If you get that student loan and you can't pay it back, y'all know how I am. I get carried away. Don't let me start talking about student loan. In my school, a lot of my students, I would go up against everybody, because I just didn't feel like they was getting what they wanted. I had to advocate for my schools to pay for their CPC. I had to advocate for my schools to make sure that all of my students had new books, not just the medical insurance billing. You can't do the medical insurance billing, because y'all know there's a part in that book. There's a part, I'm gonna show you that book. There's a part in that book where you have to do medical insurance billing with the coding. So that's why I understand why the students were not able to, y'all know which books those are. Those are the coding books, but I just want to get to the medical insurance billing. You see these books? I'm pretty sure you've seen these books, or you've seen something like this before, Annie. These are the books that we use to teach medical insurance billing. There's a small section in here of medical insurance billing with the coding. So those books have to be used. And, when we were in school, a lot of schools, they don't supply that. I mean, and I couldn't understand why. Why, when y'all getting financial aid for them? The books are supposed to go under the financial aid. But eventually, we got the books. Everybody got the books, XYZ. But this type of course, you need to put time into it. That's it. In order for you to learn how to code, you have to decipher what you are doing. When you guys get into the coding, so we're up to medical terminology. We're doing medical terminology. That class is 42 hours. Y'all already know that. I've decided to give you guys that full class because there's no way you're going to learn medical terminology. Without medical terminology, you cannot decipher the codes. You have to be able to decipher what the provider is putting in his notes. This is where we're at right now. So we've already done medical billing. We're up to medical terminology. There's 21 classes in this course. Why, Ms. Lambert? Because there's 21 chapters in that book. I'm going to show it to you right now. 3 days a week. We do Monday, Friday, and Saturday, 2 hours a day, Saturday. 1 hour is theory. The other hour is practice. And then you guys are on your own. That's your extra hour. We must be able, when you go to school, you must be able, because online is tough. You guys know that. Online, I'm telling you, you got to do double time, and that's because we can't micromanage you. I'm not watching you. That's why I made the Twitch. Somebody asked me to make the Twitch. I made the Twitch, and the reason I made the Twitch is because so we can do the long term 4 hours, 3 hours. But I don't know. We're gonna see how that work out. But what we need to do is make sure that we put that time in. So if you guys do it, I'm popping up Elsevier, y'all. If we do an hour, right? And you guys know when I do my class next week, I always go over what we did, and then I go over what we're doing. And generally, the goal is for us to spend an hour and then another hour on what we did. And that's because I want to get you used to putting time in to do your work. Where's those index cards? You remember I said the index cards, right? I know you're gonna archive this, Tatiana, because you sent me an email, but I know you're not in there right now. But what I want to show you is, because you asked me about the book. Hold on. So this is actually the book that we're in right now. And this is just to kind of show you guys what the book is. I'm gonna share my screen with you, because the problem is if we don't spend enough time on this study, it's not gonna happen. And you guys have to make sure that you use these index cards. You see how I got this? This is the key to passing your CPC. I got like a little sticky on here for, what is it? Eye and the nervous system. And then I make my cards, right? Everybody in the classroom does this. I buy this for them. Online, they buy this for themselves. So this is going to help you to retain some of the medical terminology. It's also going to help you retain some of the series. When I say series, I'm talking about the CPT sections. That's the series, 20,000, 30,000, 40,000. You'll see that when you get up to that part, Eddie. So let me go in here and I'm gonna share my screen so I can show y'all. So you should soon you'll be up to this part. This is the Language of Medicine book, which I'm pretty sure comes with your course when you are enrolled in the school. This is what we're working on now for next week. That's what we're on. And this book here, these are the books that we're going to be doing our step-by-step on. So this book right here, I'm pretty sure you'll get a chance to get through this book, Annie, because this is the one that they're going to use. So I'm not sure if they're giving you all your books yet, but this book is called Step by Step. So when we get ready to do our coding, this is the book that we're going to use. I'm going to show you right now. Hold on. Let's remove that. And the step-by-step book this is how you do the coding. This is how we do the beginner coding. Let me stop my share, then I'm going to show you all that. So that's 1 hour with me. So 1 hour with me is your theory, right? Your practice is your books. When you guys are practicing yourself, when you guys are practicing yourself, that's the theory. The practice is you doing the exercise. You're doing the test. This is the book that you use. I'm not sure which one they're using in your school, Annie, but this is the primary book that we use. We use this one and we use the workbook. Okay, and don't forget, y'all, to get this book, y'all go to y'all know always use elsevier.com. Okay, and you don't have to. Now remember what I said. Sometimes Amazon. Don't sleep on Amazon. At 3 a.m, they might have this book. And that's because I've done it several times to get people books, and I got a crash book at like $30 or $40 from Amazon. So this is where you guys are going to get the books for the course. But in general, when you are new to revenue cycle, when you are new to medical insurance billing and coding, when you are new to coding, don't feel like you get on somebody's nerves. Ask them every single thing you need, especially the teacher, especially your teacher. Ask them everything you need to ask. When you ask them, make sure you have this. Your first question is, What do I need to do when I graduate? How will I get a job in this field? What do I need to do? This is a question. Will somebody hire me as a coder right out of school? See what she said. Because see, they didn't tell me that all them years ago. All they did was just teach me a couple of things. I took a couple of coding. I didn't even think it was cases. They were mostly open and closed cases, and I had a wonderful teacher. He was amazing, but you need to tell me 100. You did not tell me when I graduated that I had to even take that CPC. You see what I'm saying? And then some of my students take it just to see what's on it, or just to see what they're going to get. That test is not easy. Years ago, it was 150 questions, but I'll tell you what, it was very, very hard. Now you guys are good. They're gonna give you 400 questions. Ms. Lambert, should I take it in-house or should I take it online? I probably would take it in-house, and that's only because if you fail, God forbid, you will take it again. Okay, you can take it again at no charge, and that's because they already charge you for the extra test. Online, I also like online because it's more savvier. If you guys decide to take it online, take one piece Monday and wait all the way to Friday to take the other half, because you got 2 times. They're gonna split it up. Okay, and why, Miss Lambert? Because that gives you enough time. As soon as you finish taking that test, boom, write down everything you think you failed on, everything you got a question about, everything you do. Don't go over the test 20 times, because that's where you're gonna mess up. As soon as you start changing answers, you're done. Your first instinct is normally it. If you have a question about it, write it down. As soon as you finish, you took this part, that next part is coming. Okay, that's for my online people. That's gonna take that test online. So in the revenue cycle department, we learn a variety of things. I pretty much like to put my people in the midst. Do I take them without CPC? Yes. And that is because if she can pass my HEM test, all right, you good. I'm gonna work with you, and we're gonna make sure you pass that test. So everybody ain't gonna be like that, but I want you to find somebody like that. Okay, if you work in the hospital, I'll give you a housekeeper. I don't care where you at, and you want to move to coding, those are the questions that you're going to ask. You're gonna be our best friend. Okay, because see, everybody's not going to be saying. A lot of people say I'm only like that because I am a teacher. They might be right. I don't know. They might be right. I mean, if she passed that HEM, I believe her. If she can get a 70 on that HEM, and this is the thing, it's the same HEM test, health information management, that I give to you guys. Okay, so YTU, you don't get that exam. Okay, that's for the Sapphire students. The Sapphire students, they do get that exam. The medical terminology and the ICD-10 and CPT code and the medical billing test and exam and competencies, YTU does not get. And that's only because this is an online. I can't give 8,000 people that look at XYZ those tests. Those tests are specifically for Sapphire. But as soon as I finish this book, I think I am finished with your medical terminology book. I will put test and quiz in there for you guys. But those of you who are on the YTU, please make sure you do the exercises. When we get to the coding, it's going to be the same thing. I want you guys to do your exercises. I still want a summary. So if you're in your coding book, okay, and you're up to oncology, I want a summary on what oncology is. Okay, if you're in anesthesia, I want a summary on what anesthesia is. So when you finish your anesthesia section, you should be part of anesthesia. I should be able to give you a test on anesthesia and you'll be okay. So that's a part of what we do in the coding. So the test that you want to take when you finish your course is your CPC, unless you want to do one specialty. Okay, one specialty. If you don't want to, take the CPC. The CPC is all the specialties. Okay. Some people are kind of scared of billing and coding. Don't be afraid. If you fail, all right, take it again. If you fail again, take it again. I know this guy. He has his own enterprise now. He and I many years ago took the same test. I was taking CPC and he was taking some kind of industrial certification license, whatever. He took that test like 3 times. The fourth time he did it. I took mine like 3 times. It's not easy. You just got to have that thrive and that dedication. That's all you have to do. When you're in revenue cycle, you will see different codes, and it's going to get you used to those codes that you are looking at. Okay. Remember, the school has to go by a crosswalk. So if you're not diving into the coding just yet, it's not a problem. They have a curriculum that they have to go by. It's a crosswalk. It's about this big. All the teachers teach the same across the board. They will get it there. Okay. Even though they're giving you a little medical billing, it's all right. On the CPC, this is what's in your mind the whole time you're in school. CPC, that's the end game. Knowing medical billing, I think you can do my full course is like 5 to 6 months. The medical billing is in there. You guys already have your medical billing. And medical billing, I don't judge whether she has had a medical billing course. I just need to know, does she know how to do an appeal? Does she know how to call an insurance company? Let me show you how to do an appeal letter. What do you do if you get a denial? So these are the things that they teach you in medical billing. What is an HMO? In case you see things that are in HMO. The Sapphire students did not do medical billing. I did not add medical billing with your coding course. Why, Miss Lambert? Because why? You ain't gonna do medical billing. I mean, you go here, get that book and read it. I don't just do medical billing class. They'll give you like 2 questions on medical billing. But I decided to go ahead and do the medical billing class because there were so many that did not know what coding was. That's the reason why I put the medical billing in there. If you are going to school for coding, why do you need billing? You don't need to be an expert at billing. You're not going to do no HMOs. You're not going to call no insurance company. Your mastery is numbers and words and putting them together and making sure you're not up-coded, making sure you're not down-coded, and making sure you're not bundling the wrong codes. Has nothing to do with medical insurance billing. When we do Zoom, what's my girl name? When we do Zoom, you should see, I mean, I'm not going to lie, coders, between the coders and the people who work inside, they always got it in for the coders. Why? I don't know. Because they work just as hard. But the coders just feel like, Ms. Lambert, I don't do billing. I don't know why she asking me that. I don't do billing. Okay, we know you don't do billing. Just tell her to call Ms. Lambert or something like that. Because the billers don't know what the coders do, and the coders don't know what the billers do. That's the problem. Okay, that's why, to me, I get everybody. I got the front end, I got the MAs, I got the CNAs, they're all up in the front. They still need to know coding. Medical assistants, I don't know about now. I mean, that was like 15 years ago. I added the coding in the medical assistant program because they needed to know what the coding is. Are the medical assistants going to code? No. But they still needed to have an insight on what the coding is. You know what I'm saying? Just a little bit, not pretty much really, but just something that they can buy a book for $10 and look at it themselves. Okay, so that's just scenario on that. I want everybody to look forward to becoming a certified professional coder. That is your end game. Okay, that's your end game. Okay, those of you again who are new to the industry, don't get halfway and get scared. This is what you do. Miss Lambert, why they giving me this? If you feel like your instructor is not giving you what you want, okay, keep asking. But if you have something, that you need to ask Miss Lambert, no problem. You guys can go ahead and call me. You guys can send me a message. Check out that website, sapphirecoding.com. Make sure you guys look at those courses. Y'all, listen, this time of year, y'all know I practically give that stuff away. It's basically for you guys to pass your CPC, and if I can do anything to help you guys do that, you guys let me know. This is for the girls who are already at that point. This is for the girls who are already at that point. So this is not your regular class for medical terminology or, billing a coder. This is just me coming on with the RCM because I got a lot of emails in regards to the RCM. So let's move on. So if you got any more questions, Andy, just let me know. Any more questions, let me know. Okay, but yes, your end goal is to take that CPC, and you need to start looking at that stuff right now. I don't know how long your course is, but you need to start looking at that stuff right now because that's what you're going to need to become a coder. Okay. And you just have to take your time and do what you need to do because don't go into something blind. You cannot become a coder without your certification. You will be able to do medical insurance billing. Okay, but you're going to need that 6 month. It's supposed to be 6 months of experience. Okay. So when you do your resume, they're still going to ask you for 6 months of experience, but you're going to use what you're doing in school. So on your resume, your courses that you're doing in school, you're going to put that on there, and you're going to put your GPA on there. Right. Excellent. Good. So that's what you're going to do. To be a medical insurance biller, you need to have 6 months. Normally, it's 6 months of doing it, 6 months of experience, depending on what hospital it is. But we would take what you did in school. So when you do your resume, you say you haven't done medical insurance before, but you've done. I mean, it's going to be hard. You're going to have to just keep doing it. You're going to have to get that pinpointed doctor that say, you know what, I'm going to take her. Because this is what I do in my office, my doctors. I take them fresh. I don't take people who have been in billing for 99 years. Why, Ms. Lambert? Because I could take you right from school and mold you. I can take you and mold you. Excellent. When you are in a school and they give you that training and you can see on that job training, you're going to have hands on. You're going to have hands on. So the Sapphire course is actually 260 hours, a little bit more than yours. These guys don't do in training. These guys are online because with all the 21 courses, you guys got your syllabus. It's about, 200 something hours, 260 hours. But when you do that, put that on your resume. When you do the intake training, put that on your resume. They're going to say, well, she hasn't, physically worked, in a facility XYZ. How long has she been? You can bypass that. Put what you did in school, and they will give you a chance. Now that's for medical billing. I don't know to what extent they're going to give you job training because you will not be allowed to go in the finance department because it is on lockdown. So maybe they got something to hook up over there or something. Because I was allowed to go in there, and that's only because I knew the CEO of Duke and he let us all in there. But generally, all that stuff is on lockdown because of the HIPAA. But I'm pretty sure the school has a link to get you guys in there and get you guys to do that on the job training. So the goal for you, and that's good because that helps you kind of get used to in-house. But I don't know if you're going to see any coders in there because the coders work at home. You will not see coders on ground. Even if you are at a facility, at a faculty practice is the business office. The business office is where the billers are. The business office was account receivable. That's hospital. If you do clinical, if you do facility, a clinical facility or a small place like that, they will be on ground. Sometimes you have the older coders that's been there for 45 years. And she's probably still on ground checking the other ones because she doesn't want to do it home. But 9 times out of 10, all the coders are home. But I'm pretty sure they'll give you something to get the feel of what the coding is and see, I guess the environment because the cases, the direct intakes, they will not let you see I mean, that's HIPAA, that's PII. You won't be able to personal, information. You will not be able to see that, but you still will get the feel of going in there. But again, I want you to see the logic of to that extent. When I took my students on trips, on Duke University. I'm gonna put those pictures up, y'all. I take them on trips because I want them to see what it's like to be in a facility, see what it's like to see what's on lockdown, see what it's like to talk to the anesthesia doctors, chief doctor, the revenue cycle managers, and different things like that, to see what actually goes on in a hospital. And then they go, wow, yeah, I want to work, I want to work in here. But as far as taking them to the actual business office, we're not able to do because of the PII. So when they give you the on-the-job training, did they specify what the on-the-job training is? Are they taking you in the finance department where the accounting is actually done? Because they have so many different things. But this is geared towards like medical billing. This is geared towards like, I think I can add to my resume. Yes, you can add that to your resume. So in medical billing, you guys, you have accounts receivable, accounts payable, you have collections, you have private pays, self-pays, you have your adjustment department. There's so many different things in there as far as revenue cycle. But they do have some smaller offices, let's say doctor's office. You'll see coders on site. You see coders that are actually on site because those are physician offices and they own that practice. The surgeries that they do, the money that they make is theirs. If they work at a hospital facility, they own the payroll. You barely won't hear from their doctor. Oh, all right, let her fix it. Yeah. Whether you fix the code or not, the hospital has to pay that provider what he is due. When you have a surgeon, a neurologist who has their own office, you need to be his right hand. You guys know I say this all the time. You've got to be his right hand. Why, Miss Lambert? Because those codes got to be precise. See, in a hospital, you're not going to have a doctor come in. Lisa, why she changed my, Lisa, look at her. When she changed my code? Whoa. And y'all know in my mind, I'm going, why you got to cut? Don't you see I'm doing something with you? This is the owner of the practice. They always, Lisa, my coda, she always in Kansas somewhere. Hold on. You see those? You're in a hospital, they don't do that. They're not coming in your office to say what you do. They're not doing that. Why, Miss Lambert? Because they know they're at home. So you guys see the difference? So Annie, make sure you feel out also where you want to work, who you want to work for. Because remember, they need you. They need you. And especially now, y'all, the hospitals some of the rural hospitals, some of the clinics too are closing. Why, Miss Lambert? Because believe it or not, Medicaid, if you have 1 million patients on Medicaid, and y'all know I always said, if you have 50,000 commercial insurance, you will make the most money from Medicaid. Those hospitals, if they mess with that Medicaid, those hospitals do have the code. They're not gonna get no money. And those of you who out there billing, y'all gonna do double time. Did y'all see the thing on Twitter with the poor girl? And she said, look, we got authorization. We got the number. We got the this. We got the that. And United Healthcare said, no, we ain't paying. But you gave us the authorization. You said it was okay to do this surgery. A medical necessity is, this is the workup. That's a medical necessity, y'all. So the day she comes in that hospital, this is revenue cycle management we're talking about. The day she comes in that hospital, it's a paper trail of what happened to this woman. What happened to this woman? What happened to this woman? Boom. The doctor say, oh, she needs surgery because XYZ. That's the medical necessity. United Healthcare, give me the medical necessity. Oh, we did. Oh, we ain't got it. We ain't got it. We ain't got it. You see? That's the difference between coda and biller. The biller's gonna bust they behind getting that money. Don't get me wrong, because the coders, y'all know y'all are fully responsible for putting in that right code. The only way the coder is gonna be, I'm gonna be like, well, why you ain't so? I'm not gonna be like that, because as long as that claim was submitted on time, y'all know I'm not gonna be, because we're gonna win. Whether the code is wrong or right. If the billers submitted this, let me show you how to do it. Intake, charge entry, coda at home. She got it now. Coda at home, making sure codes are correct. Coda is finished that scrub, fix the codes to the right codes or adjusted your codes. I'm coming back around this revenue cycle. It goes back into the queue. Now where's it going? It's going to the billers. The billers drop that claim. The billers must drop that claim on time. My coda, she's already clear right now. She's already clear for as far as dropping that claim. As long as we got cue that claim was dropped on time, they cannot deny that claim for late filing or we did not get it. If they say they didn't, we got a paper trail and we got a EH number that they did it. If they say, okay, we got it, but the code is wrong. All right, code ain't wrong. All right, we still in 110. We're coming back around. Accounts receivable, they're the ones who are getting that. Accounts receivable is getting that. They say, okay, this is why we ain't giving you the money because the code is wrong. Boom, there goes. It's not quite a denial. It's more or less a rejection / denial. Don't make me get into that. Y'all, you know I'm gonna go. So we're coming around. Bing, she sends it back to the coder. She fixes it. Boom, they pay us. See? Now, y'all heard me say denial and rejection. We still in revenue cycle management. Denial, they put the claim in there. We don't think it was medical necessity. We don't even think she should have had it. Deny. Okay? Rejection. Y'all don't spell her last name wrong. Claim rejected. It's not going through the clearinghouse. The date of birth is wrong. That's a rejection. Okay? There's a difference between the denial and then the denial. What we're going to do, y'all, we're going to appeal the denial. I don't care if it's right or wrong. I better see a paper trail. When I go in their queue, I better see somebody that touch that claim and better say we get ready to appeal this. If she goes back into rejection, who's gonna fix the rejection, y'all? The billers, the front end, accounts receivable. Who? Send it back to the front end. They the ones who messed it up, so they got to fix it. Okay. They got to make sure her name is right, make sure her insurance is right, XYZ. That's the front end. Okay. So, that's a little bit about, the revenue cycle. And, I want to make sure you guys, because I got a frustrated email from somebody. I mean, she ready to quit. I don't know where you at, but send me another email. Do not quit. Billing is frustrating. Coding is frustrating too. Listen, coders, the hardest thing you're going to do is to pass your CPC. That's why we are going to work like hell and we're going to pass that CPC, y'all. The study is nothing. The study is retaining. Y'all know I'm all about retaining. Make sure you retain what you do. Hey, make sure you retain what you do. Whatever they give you, make sure you retain it. You ain't clear? Ask a question. You must pass the CPC. There are 10 cases on that CPC. 4 of them are going to be this big. So you have to retain. Your diagnosis is going to be nothing. You're going to find a diagnosis before you even finish with the case. There might be 5 codes in that case. Pay attention. When you get your CPT book, even if you haven't gotten up to that part yet, look through every single page. Y'all wait till we get to our core courses. We go, Andy, stick with us. You come in with us. We're going to show you. Everything that you see in that book, remember, there are codes that look alike. There are ICD-10 codes that look alike. Okay, you guys are going to highlight what looks alike so you can differentiate. Because on your CPC exam, they're going to trip you up like that. Y'all know what I say. Do the short answers first. That's your open and close. What is the XYZ, ABCD? That's a short answer. These are your long answers, the cases. You got 2 minutes for each one of those questions. I want you to spend the most of your time on the cases. That's why I want y'all to do the short answers first. Do the open and close first. Boom. 1 minute. Now you're saving that minute for the cases. Okay? So, y'all get me thrown off. I'm talking about coding. We're supposed to be talking about what's the day. But don't forget to get on that coding class. But I'm telling you, if you guys got a question, do not quit. Sometimes you could get frustrated with your boss. You can. We all have been there. Y'all know when I was in the OR, the new nurse came and, she pissed me off and I walked out. And I messed around and quit. And then when I walked outside, I said, shit, who paying my car payment? The rent was due. And, I didn't even care at that point. I was like, well, she talking about I didn't get them instruments in there on time. She wasn't even there. So anyway, I had the instruments in there. The surgery went on. Everybody went so and so. But I was just done. I was like, why do people bother with this? But anyway, I got back in. I did get back in. But thank you so much, Tonya. Thank you, Marie. They got me back in the hospital. And nobody believed I was actually still working for the hospital, But when I got back in, I was in billing. I was in accounting. Well, chief anesthesia. He said, Lisa, where you been? I was gonna put you out anyway because you're too emotional. And I'm not gonna lie, Em. That's I was gonna leave the OR anyway because I just couldn't take the surgeries and the craniologies and the water from the cardiology. It just is heartbreaking. Shout out to all the RNs, who work in there. And all of y'all, I see y'all on Long Island Jewish on my Instagram. And some of y'all are still there. Kudos to them, man. Nurses, it's hard to work in the OR to me. I mean, you just emotional, especially when a child has to come in. You got an emergency or you got a broken leg on a baby and they run in there and then oh my God. So long story short, don't get too pissed with your boss. Don't get too pissed with your boss because you want to think about tomorrow before you walk out of there. Before you walk out of there, think about tomorrow. I always tell, my girls, go in the closet before you talking about quitting. Go in the closet. Unless, you have a backup plan, or, you live at home with mine, you be all right for about 2 months, don't do that. Sometimes there are different types of leaderships and y'all look that up. Look that up, different types of supervisors. And some supervisors are just straight hardcore. Some supervisors are more to the point. Some supervisors ain't gonna waste their time. And that's just the type of, when you do a resume, those of you who might be going for supervisor, they ask you that, what type of supervisor are you? I'm more of a, conventional supervisor. I'm more of a democratic type of supervisor. I'm on both sides. That's what that is. And I'm more like, I like to teach my students to grow. I'm going to teach them how to grow and be higher than I am. So that's the type of supervisor I am. But you guys look that up. So don't do not quit your job. I don't care how mad you are. So I saw all that frustrating in that email, but don't do it. Okay, don't do it unless you know you getting ready to work right after that. Don't do it, especially with all the federal issues going on, the layoffs, UPS, and the, IRS. And don't do it. Okay. Okay, so don't make any appeal. Don't make any errors on those appeals, y'all. Make sure y'all check out that Grammarly. It's called Grammarly.com. I use it too. One of my CEOs, I'll tell you, if I made an error on an email, don't send me that email. I make sure I use Grammarly before I send something. I write just like how I talk. Y'all hear me talking? I do talk, write just like that in my office. So don't do that. Okay. Anytime I send out an email, I'll try to make sure I use Grammarly first. Okay. Let me see if I got all the questions. We talked about the denied claim. We talked about error. We talked about rejection. Somebody asked me about that. Do we need to learn billing with coding? I don't know. Did we talk about that? No, we talked about that. You don't need to do medical billing with coding. If you're going to take your CPC, you don't need to do medical billing. You can again, this is a self-taught class. You buy the book, read XYZ. There's only going to be 4 questions on something like that anyway. You guys look at chat 13. We went over AAPC and what's going to be on it. Most of your open and closed questions are 90%, 10% of you will have your cases. And one of those questions, 4 of those questions are going to be medical billing. 6 will probably be medical terminology. So no. I mean, they may ask you X, Y, Z, but it's really for you. In case what if you want to move around? What if you do want to go billing? What if you want to work 2 jobs? What if you want to do coding? Then you want to go over to that hospital and do billing? So that's why I say, just learn the billing. Those of you who are already in the coding and you just want to brush up or something like that, just do the brush up. You guys remember what I told you when you are in training and you only want to do GYN or something like that, medical terminology. Just do that. You don't need to do, I'm pulling up something. You do not need to do the whole 21 points. Okay, you don't need to do the whole 21 points because I have who's that took just cardiology. I think Shanae just took she just took cardiology because she works for a cardiologist. So her thing was thank you, Annie. Her thing was what should I take, Miss Lambert? We got what time is it? We got 6 minutes left. What should I take, Miss Lambert? If you are not taking the full exam, you know, if you're not taking the full CPC, I don't see the reason for you to do that full study. Just do cardiology. You don't need to do the whole thing. I'm going over here to jump over here. So those of you who are still in YTU, and those of you who are looking at this screen right now, this is for YTU, and I'm not gonna spell it out. I'm gonna show y'all. These are the individual courses, and as you can see, this time of year, this is when I put this here. Okay, this is when I put this here. So you guys see this? This is a full courses. And this is for YTU. Now, these are just pictures up here. These are just pictures I got up here. The courses are all downloadable. Do you see that $59? Do you see that $25? Do you see $9.99 for all of them? Okay, and that's to help you. Okay, if she's only taking evaluation and management, this is what she's getting. As soon as you hit this, you go to checkout. It is $9.99. So you guys remember it was $53 or $79 or something during the summertime, especially for my birthday. And today is my mother's birthday. That's why this is knocked down. Okay, that's why this is knocked down. So when we have, let me put me back up. When we have my birthday, my kid's birthday, those holidays, this is when I do this. Okay. So I don't know where you are, Annie, but if you cop this, you can use this in your class, okay? So again, you guys do not need a Q code or anything. I've just knocked this down because today is my mother's birthday. Happy birthday, Mom. So that's how we rolling. Okay, we got like 6 minutes. So those of you who are in a coding class, you could always come to this class for questions. You can always look at anything in this classroom. Same thing for you, Annie. Even if you are in school, you could ask Miss Lambert whatever you want to. You are in that school. Whatever you want to ask me, you can. If you want access to Sapphire coding, I will give you access to the Sapphire coding. And the Sapphire coding school is like a portal, Annie. On the last chat that we did, I did put something on there. And if you guys can see, for you to get into that portal, it used to be $1,300. And this is for my YTU students. And why Miss Lambert? Because I want to create something for my YTU students because we're changing world education. So if you guys can see, this was my first course. It's the advanced training course. It was $1,389. It's $59. I made these $9.99 so it was more accessible to you so that I can give you more. The only way I can give you more of Sapphire Academy, you have to purchase one of these courses. So let's say you're only doing diagnostic coding right here. It's still $9.99. It was $60. And it's like that because I want to give you guys a little bit more, but I can't do it unless you are in that classroom. If you do the $9.99, then I can give you more. When you get to that course in your school, I'm going to give you, I can give you a couple of HIM tests just so you can see what you're getting into. So you can see what type of coding courses you are getting into. I have one coding courses that we have already put in here. But see, that's for the Sapphire class. Those students are paying students. So I can't give you guys those unless you are one of my students. And for you to be one of my students, you just need to purchase one of those $10 courses. That's it. You will get a Sapphire coding email. You will have access to the Sapphire coding school, and you will have access to those tools. When we get ready to go to the coding class, our coding class is actually next Let me see this. 21 days, 21, 42 hours, 21 days, 2 hours, 21 classes, Thursday. All right. So it's 21 classes. So this class is about 2 or 3 weeks. Let me see. 1, 2, 3, probably about 3 weeks. Y'all figure that out. It's 21 classes, 3 days a week, right? It's 3 weeks, right? So we're going into the coding in about 3 weeks or so. I got to put this book up here because anybody, all y'all who's getting ready to archive this class, you must have the book. Okay. We can't do, how can I teach you coding if we don't have the book? So we've got to get the book, y'all. Even like I said, even you go to thrift.com. I want y'all to go to thrift.com. I have students that have gotten the book for cheap. I'm talking about the step-by-step book. You guys do your CPT. I want you to get the new books. Why, Ms. Lambert? Because when you take your test, you've got to have the new book. Well, okay, I won't say got to. All right. So AAPC, you can get the book, the book before, but we preferably want you to get the 2025. Okay, those of you taking 2025. Okay, so this is, I'm gonna share my screen with you in a minute. So this is the step-by-step book, and I want to show y'all something, which is, this is probably what they should be showing you. Maybe they're showing you this portion of the billing, because even in this step-by-step, there's a portion in there. So you see this book, right? I have the ebook, so I have the teacher's guide, but your books is the same thing. So this is a part of billing, reimbursement, HIPAA, and compliance. The first chapter in your step-by-step book has this little bit in here. This is all you need to know, really. You don't really need the long medical billing course unless you want to. Y'all know it's the one I have on YTU. It's free. And I'm revamping Sapphire, and I'm going to push those courses, the class courses here. Okay. So this might be what they are showing you at that point. Let me see which one I'm on here. Okay, so we're going to take that down, but that's the book that you guys are going to use. I have so much stuff up here. That's the book that you're going to use. If you get stuck, if you are home and you're working, doing your coding and you're not sure where you're at, don't hesitate to send me an email. Don't hesitate to send me an email, because there's going to be times when you need assistance. This stuff is not easy. It takes perseverance and taking a couple of hours. It's taking a couple of hours, okay? And this is my book. We've used this book for years. This is the book that you would use, in your school. And this is the first chapter: basic structure, Medicare, health insurance, Federal Register, outpatient resource, basic RVUs. That's in the CPC book. You guys, those of you who got the CPC, we're gonna have a test on that. Okay, Medicare fraud, managed care, healthcare. That's the basics. That's the basis of what you're going to get. As far as y'all ain't see that, okay, they put it up. Y'all didn't see that, but this is pretty much what you need. Why, Ms. Lambert? Because that's all they're probably going to give you on the CPC. They're probably only going to give you this much. Okay, that's why it's crucial. So when we finish with the medical terminology, this is where we're headed. You see, we're headed here. This is where we're headed. Okay, that's why I need y'all to get your books. That's why I'm hoping that the medical terminology course is going to be about 3 weeks or so, to give you guys a chance to get this book. I caught one. It was on Amazon. It was $70, y'all. That's why I want y'all to catch Amazon when y'all can. Okay. So, and also, if you go to, I'll remove that, elsevier.com. Okay. They're supposed to give y'all 25% off. So let me know if you don't get the 25% off. You're supposed to give them Sapphire Physician Coding LLC. That is the name of my school. I'm already in there. All the teachers in the colleges use Elsevier. That is where we get our books from. That's their site. And this is where my books are from. So my library, as you guys can see, that library is Elsevier. And they've already given us permission to use these books on the YouTube. If you guys look below and you see that thing, little layout, and it says, this is how you get the books, or this is how you go on Elsevier. They're the ones who wrote that for me to put that on there. So That's the reason why I make sure I let you guys know where we're getting these books from. And again, here's, ICD-10. And if you guys can see, this is a beginner class. We do beginning and then we work our way to the tough stuff. So as you guys can see, this is your overview. What's your overview, Ms. Lambert? The overview is where it is. Where does it come from? Why do we use it? Who started ICD-10? You see what I'm saying? That's where we're starting from. So some of you who are actually in school, this is kind of giving you a heads up of what you're getting ready to get into. In order for you to pass that exam, you must know all. I'm gonna put CMS in there. I will stick it down. You must also know where it came from, who started it, what is WHO, what is World Health Organization, what is CMS, what is AHIMA, what is CMS. Is that on your test, Miss Lambert? It sure is. I'm ready to pull that up for y'all. And the reason I'm gonna pull this up for you because sometimes the books is a lot of money. The ICD-10 book is about $110, but I've seen it for like $98 on Amazon. So the only book that you need to go AMA for is the CPC. And when you go to the CPT for AMA, American Medical Association, they're gonna direct you to Amazon. Okay, because years ago when we used to go in there, I used to just buy directly from them at the AMA store. But you can also go to the AMA store and take a look at it. So I'm gonna pull this up because you guys have seen this already. But again, some of you who are in school, you want to know what you're getting into. This is what you're getting into on your CPT. When you graduate, okay. You don't even have to graduate. You don't need a degree to take the CPC. You need to have know-how. You need to know what you're getting ready to pass. You need to make sure you got $500. That's it. You see this right here? This is CMS.gov. If you do not have your ICD-10 book and you want to get a jump on it, you want to study early, some of this is on the CPC. This is the beginning of your ICD-10 book. It is free. We are not copywriting anyone. This is what shows you where it came from. Was it ICD-10 first? Why do we add clinical modification? Where did it come from? Who started it? So you see what I'm saying? So read your guidelines 10 times. I don't care how many times you read it. Take notes on it. What is HIPAA? Where did Center for Medicaid Services play a role in this? These guidelines have been approved by the 4 organizations. This is on your CPC that make up the cooperating parties for the ICD-10-CM. American Hospital Association, that's AHA. The American Health Information Management Association, CMS, and NCHS. I'm telling you right now, that's crucial. When you look this up, I want y'all to, what's the index card? I got it buried over there somewhere, but make sure you got your index cards. Study. Y'all know what I'm getting ready to say. Martin Luther King was a born leader. Malcolm X, they trained him to be a leader, right? That's the type of thing I want you guys to have. When you go in here, this is going to show you where everything is. On your AAPC, sometimes it's on your AAPC, they want to know, can you go through this book? They want to see, have you mastered the ICD-10? So when you guys go here, they'll say, take me to A12C or something like that. And then you end up in, combination, sequela late effects. What's sequela, Lisa? Sequela is you have an accident and I broke my leg, and then a year later, my toe start hurting. That's sequela. It's like a late effect. So they may say, well, where's that at? And you got to find it. It's on page 13, but it's in AB1XYZ. You see what I'm saying? So that's what you're getting ready to get into. This portion is just the ICD-10. So it's Sapphire, Y2U, y'all. Y2U is YouTube University, Medical Building Coding. This is what you're going to start with first, okay? Then we're going to go into why do we use 2 codes? Why do we use 3 codes? Why, Ms. Lambert? Because it's going to be your CPC. You have to remember, this course is all about the CPC. There's no other reason that, I developed this course. You must pass your CPC. Ms. Lambert, do you need to go to a medical billing and coding school? No, you don't need to go to a medical coding school to take your CPC. Okay. You don't need to go to, something that you need to go to for like 12 months. If you want to go to school and get a degree, that's fine. Because I went 10 years ago. But you don't need that to take your CPC. You need YTU, or you need Sapphire Academy, or you need the books and go in the house and train yourself, because that's what this is. I train people to self-teach themselves, okay, how to do a skill to prevent you from going into debt. So that's the reason why I try to give you everything that you need. The goal is for me is that you develop self-study. School and college, I am not anti-college. You guys already know I have 1,000 degrees. I am not anti-college. I'm anti-medical billing and coding college. Why, Miss Lambert? Because I don't think students should pay thousands of dollars to do a medical billing and coding course that does not benefit them. What's going to benefit them is taking the CPB, Certified Professional, I can't even say it. What is it, y'all? CBP, Certified Professional Biller. Okay, Certified Professional Coder. Okay, if you can pass a Certified Professional Biller, you good. If you can pass a Certified Professional Coder, you're good. You need those two certifications. If you go to college, they give you insight. I want y'all to, if you're in there, I want you to continue going. I want you to steadfast on it. But those of you who are not, and you are thinking about doing a medical coding course, subscribe to my channel. I'm gonna give you everything I got. Why, Miss Lambert? Because that's what I want to do. That was the purpose of me and Sinclair making this program. Sinclair used to be my regional director. When I started teaching many years ago, I came in actually as an instructor from the accounting department. I had no idea I even knew how to teach. And the director who he hired me, he said, "You're in the right place." I said, "What's that? Teacher?" I said, "Teacher." I said, "I don't even remember putting in for no teacher." And his name was Tyrone Everett, and I'll never forget him, And then, as time grew on, I became the teacher lead, and then I became the director of the school, and then Sinclair became the regional director. And this, was his idea to create this program. And we kind of thought about the fact that the students were paying a lot of money for the program. And I said, you know what? I can teach the program without them getting that, without them having that burden of any type of money owed to the government. And he said, "Ms. Lambert, I'm giving you a task right now." He said, "I want you to complete this course with these kids, and then I want you to develop a program that they can do online." And that's what I did. And now the program is being given to you. So I want you guys to make sure, even if you are in school, it does not matter. I'm going to show you what you need to do. If you get stuck, let me know. I'm still going to show you what you need to do. Ms. Lambert, do we get a certificate at the end of this class? YTU doesn't, because you guys don't take the full course. They do. Okay, do that $9.99. You finish my course, you'll get one. My course is 5 to 6 months. And when you guys see me reduce the course and it says 20 weeks, I haven't taken anything out of my course. My course is 5 to 6 months. Why is it 5 to 6 months, Ms. Lambert? Because you got to have 5 to 6 months of medical billing. The coding, no. You have to have 5 to 6 months of medical billing. And if I crunch it to 20 weeks, all I'm doing is suppressing your courses. Instead of doing 2 courses a day, you're doing 4. So that is nothing, nothing taken out of that. Some of you who haven't seen my course, just check it out, okay? Absolutely. And that's what we want you to do. We want to help you on many different levels, and we want to put you in the right place. You guys make sure that you look out for your schedules. You guys know I make schedules for you guys, because some of the things that you need to know, you have to be able to retain what you know. This is one of your schedules. I'm just kind of dropping this up here. Hey, Abiskis, good. I'm glad you're home. Okay, so we just want to kind of show you that. Thanks for popping in. And, this is just some of the things that we're going through. We're going to have some new people coming in this afternoon, and we want to kind of just show them stuff. That's why, who's that? Michelle asked me to do the, these are some kind of like old slide stuff that we just kind of pull up. And this was like old that we already did. But they asked me to do that Twitch thing, and I'm working on it because they want me to be on longer. But I still think we can be on longer on this one. So here's a schedule. I just want to show you guys a schedule. Okay. So this is the Sapphire schedule, which is the same YTU schedule that we're doing. Okay, so this is where we are this week. We're working on medical terminology. So you guys know, I haven't gotten a chance to put this up at the beginning, but you guys know I always show the books in the beginning, and I always show the schedule of what we're doing. Accreditation comes in. Ms. Lambert, what are you teaching? How long are you teaching it? How many hours is it? In your syllabus, it tells you how many hours the course is and what we're teaching. This is what we're doing now. Okay, that's your medical office administration. We finished that last week. You guys remember we did that. That's the rest of it. Okay, all of this was what we did. Your next course is medical coding. Okay, your next course is medical coding. And this is your computerized billing. I'm pretty sure they're going to give you that, Annie. You're going to get that computerized billing. I actually had the customer service down here. I took it off because there's no need for it. But they're probably going to give you this in your medical billing and coding course because you have to know how to use an EHR. We do have a little course in EHR, you guys. We use Metasoft. I'm not sure which program they may use at your school, Annie. They may use Metasoft. Metasoft is a teaching program. They cannot use Epic because that is a hospital program. It is not for teaching. It's for teaching in the hospital. So as revenue cycle trainer, yeah, we use that in the hospital to train on. But when you're in the school, they have us use Metasoft or something like that. They don't even have one for Athena. And those are different EHRs, Athena, IDX, Epic, Mises Tiger, eClinical Works. I know some of y'all are working on them. So we are already an hour and 16 minutes in. I just wanted to kind of touch bases with y'all. So this is not our regular class. This is us just kind of chit-chatting and jumping in. Anybody have any questions for me? The website is down below. All the books with the ISBNs are down below in case anybody wants to get their book and they need an ISBN. The Sapphire Coding website is also down below. You guys know it's time for me to update my website. So I am changing the website, you know, because we're like we're in summertime now. So, you know, I usually have a lot of dark colors during XYZ. So I'm starting to change it. And I'm actually still working on that website. But you guys can still look at it. It's not a big deal. I got it out there. I already got it live. I can still show it to you guys. You know, you guys know I always show you guys the website. So this is the one I'm working on, and you guys know the other one. So let's see. If you guys want to get any of those courses, all you got to do is jump in there, and you'll be able to see those courses. So this is the website. And this, you see this right here? This, if you go to the website to get to the courses, they're only like $10 now. You can click on that, and it'll take you straight there. If you guys want to send a message, that's the administration number. You can actually use that number to send me a message right here. Okay, so this is the website, and this is one of the links for billing and coding. You guys can also check this one out. I've got 15,000 or 14,000 streams on that one. So thank you guys for looking at this. I love this video myself, but we've got about 14,000 views on that. You guys take a look at that. Okay, I'm gonna take this one out because I don't know what's gonna go in that little slot right there. So again, here they are. And look, administration still has them for $53.99. They're not $53.99 now. We're already taking that down, but I'm just showing you guys what they were. Look, the individual courses, that's how much they were. Medical billing, medical coding course, medical terminology. So you can see the hours, 15, 24 hours, 20 hours. That's only 3 courses of the 21 courses. So you can see how many hours the course is, okay? So right now I only have this one on. I'll put the rest of them across there soon. But that was just a quick look at the website that we have. But again, I will have administration fix that. I've taken them down for my mother's birthday, so they're like $9.99. But again, you guys can get to look at the syllabus and all the other things that are in the course, especially to help you. I'm trying to think of what else I could let you know in regards to that test. I would also go to www.aapc.com and take a look at that. Go into certifications, and it will show you all of the certifications that are actually there. It will actually show you the CPB as well. The CPB is Certified Professional Biller. I ain't asking her no questions. She come at me with a certified professional biller. I'm hiring her right on the spot. I don't even care if she went to college for medical billing. Why, Miss Lambert? Because I know she's mastered that already. You see what I'm saying? The CPC, Certified Professional Coder. She comes at me and she already has her CPC. I ain't asking no questions because I know she can ready pass this test. I don't care if she went to school. You see what I'm saying? But different people, different strokes. But in order for you to get an introduction to medical billing and coding, do what you got to do. I'm not going to say don't go to school, don't so and so. But the purpose of Miss Lambert is, you guys out there know y'all going to archive this. I want y'all to take these classes. You're talking about $10. Tell your friend, tell your best friend. Subscribe to my channel. Y'all gonna be billers and coders for $10. Okay, the courses is nothing. You are going to use those courses and you're going to combine them with what we are doing now. What we're doing now, Miss Lambert, this is theory. This is theory. So we have the 1 hour theory, we have the 1 hour practice. So when you're practicing, you have your book. So I'm already lecturing. Once my lecture is over, sometimes it's 2 hours. Once my lecture is over, it's time for you to do theory. Because within that 250 hours, for them to break down that 250 hours, Annie, they have to have theory and practice, and it has to be on their syllabus, and it has to be in a crosswalk. You don't see that, but the higher ups see that. Her administration has to see that. Her director has to see that. When accreditation come in there and they start walking around the building, she has to show them how many hours you spent on coding. How many hours you spend on practice? How many hours do you spend on lecturing? She has to have that broken down piece by piece. So, yes, that's what we are going to work towards. I want you guys to make sure that you are in on this chat, your friends and everybody else. The books are there. The websites are there for you guys to know. So I'm going to sign off. ED.CLS, I'm glad you came in. And I will give you guys another shout out on Friday, but make sure you guys get those books because we coming. I'm not telling y'all don't get no student loan. I don't care if y'all in class and y'all pay already and y'all got Pell or whatever it is, come and see me. I'm going to help you pass that test. Whether you're in school or not, follow those chats. We are going to pass that exam. Annie, we're going to pass that exam. Don't worry about it. Go on to AAPC.com. I want you to get a feel of what you get ready to put your feet into. And if you are not, let me see. If you are not that familiar with the medical insurance billing and coding, I still want you to also check out Amazon.com. When you go on Amazon.com, put in my name, put in Lisa Lambert, and my books will come up. So we have books that we've written, and these books are pretty much, let me pull it real quick. This is a medical insurance billing book. If some people don't like to be online, some people like to sit and read. My first book that I did for you guys is Medical Insurance Billing and Coding Q&A. So the Medical Insurance Billing and Coding Q&A book, that book tells you what medical billing is. It tells you what medical billing is. It tells you what coding is. It tells you, this is a good one for you. I got a couple of books up there I'm going to pull down. This is one of my books, is Sapphire Physician Coding. I'm going to put this up on share it on the screen. And this helps people who have never been in billing before. This helps people who have never been in billing before. Thank you, Annie. So when you are new to billing, I want you guys to get this book and be sure it's what you want to do. Before before you actually go into the school. Okay, where's that other one? This is the one I want you to see. So this one is the medical billing and coding Q&A, which I think is very good, especially for people who are new to medical billing, who are changing fields. This book is $29.99. It's on Amazon.com. You see how I type my name in there, Lisa Lambert? All of my books should come up. The MT book, we can ready drop that one tonight, but you're not going to see it until next week. If you're changing professions, anybody you know, your friends, your cousins, your uncles, whoever y'all, if you're changing professions, I want you to get this book. This book says what is coding, what is XYZ, how do we code, what material do we use? I'm pulling my book. Okay, you see this one? This is the same thing. Medical insurance billing and coding. Okay, medical insurance billing and coding Q&A. Okay, by Miss Lambert. Annie, I know you're out, but when you archive this, make sure you get this book. And those of you who are probably thinking about going to medical insurance billing school or medical billing and coding school, it's still good. If you want to go, that's fine. But if I can prevent you from going there and getting a loan or anything like that, don't do it. Okay, come to YTU, subscribe to my channel. Because what if you don't want to do medical insurance billing? What do you get? $30 ain't gonna hurt you. Pay $30 for this book. It's not gonna hurt you. For you to know why you get ready to spend $20,000. Okay, but if you're already in there, I ain't gonna beat you up, but you're gonna be in this class. We're gonna make sure you pass. Those of you who are already in there spending money for the school, it's okay because we're still gonna get you there. It don't make a difference. Okay, we still gonna get you there. So just make sure you check out this book. And those of you who are already on YTU, didn't I put this in the ebook for you guys? If it's in the ebook, I don't know. I think they took it off, or I don't know. Did y'all take that off? No. All right. So we'll see. You know, if it's in there, it's in there. You know, but it should be because I gave YTU an e-copy of this book, right? Okay, so I keep saying I'm out of here. I'm out of here right now, y'all. I just want to come on and do a quickie. Do not miss that chat on Friday. All right. Revenue cycle management. We are signing off. Bye. Thank you for coming. Don't forget to subscribe and watch those videos, y'all. Watch those videos.